Hello, hello.
Hello, everyone. Welcome and thank you so much for joining us today. If this is your first time watching us, my name is Dr. Mariana, a bariatric coordinator. I have the privilege of guiding patients through every step of their weight loss journey, from their very first consultation all the way through surgery and recovery. And today I'm joined by someone many of you already know, Dr. Edwin Guerrero, board certified bariatric surgeon. So, Doctor, thank you so much for taking the time to be here today.
Thank you, Dr. Mariana, and hello, everyone. It's always a pleasure. And thank you to everyone who's joining us live today. Whether you're considering weight loss treatment for yourself, or a family member, or you're simply here because you're curious and want to learn more, we truly appreciate you taking the time to be with us.
Okay, so doctor, before we start the live, we were talking about how much information patients can find online these days. Some of that information can be excellent, some can be really confusing. One video tells that the gastric balloon is the best option, another says surgery is the only thing that works. Then some other information recommends the medications. By the time the patient finally come to us to consultation, they're basically overwhelmed.
Yes, that's absolutely true. And I see it every single day. Patients often come to my office after spending hours or sometimes even weeks watching videos, reading articles, or scrolling through social media. By then, they hear so many different opinions that they are no longer sure what to believe. And honestly, I don't blame them. Today, we have more weight loss treatments available than ever before. That's actually a great thing for patients, but it also means choosing the right treatment has become much more confusing for patients.
Yes, exactly. And honestly, I think that's why we wanted to have this conversation today, not to tell people exactly what to do, but to compare these treatments objectively, explain where each one fits, and help patients better understand uh, which options may be the most appropriate, depending on their individual situation.
Exactly, because there isn't one treatment that is perfect for everyone. Every patient is different, every medical history is different, every goal is different. Our responsibility as physicians is to understand the patient sitting in front of us and recommend that treatment that gives that individual the greatest opportunity for long-term success.
And I think that's something patients don't always realize. They ask doctor what's the best procedure, but maybe that's not really like the right question to do.
I completely agree. In fact, I think it's probably the biggest misconception patients have. They are trying to find the best procedure when maybe uh, they could think which treatment is the best option for me. Those are two completely different questions, right?
Yeah, I love that because that's exactly where we're going to talk today. uh, but before we compare the gastric balloon and the gastric sleeve surgery, I think we should take one small step back because I believe many people still misunderstand obesity itself. So, doctor, when someone walks into your office, are you treating the obesity or are you just like simply helping them lose weight?
That's probably the most important question we'll discuss today. For many years, obesity was viewed as a simple problem of willpower. People believed that if someone gained weight, it was because they weren't trying hard enough. They were told, just eat less, exercise more, you need more discipline. Fortunately, our understanding of obesity has changed dramatically. Today, we recognize obesity for what it truly is: a chronic, complex disease. It's influenced by genetics, hormones, metabolism, sleep, stress, certain medications, our environment, and many other factors. That's why treating obesity isn't simply about telling people to try harder. It's about understanding why the patient is struggling with excess weight in the first place.
I really like hearing you explain it that way because after talking with hundreds of patients over the years, one thing I've noticed is that so many of them come to us carrying an enormous amount of guilt. They say like things like, I've tried every diet you can imagine. I lose 20 pounds and then I gain 30. Maybe I just don't have like enough willpower. And honestly, it's heartbreaking to hear that.
It really is. And one of the first things I tell my patients is you didn't fail. Most people living with obesity have already tried incredible hard. They've tried commercial diets, personal trainers, fasting, weight loss programs, supplements, even medications. Many of them have actually lost a significant amount of weight, sometimes more than once. The problem usually isn't losing weight. The real challenge is maintaining that weight loss over the time.
That's such an important distinction because almost anyone can lose weight for a few weeks, even for a few months, but maintaining that weight loss for years, that's where things come much more difficult.
Exactly, and that's why obesity treatment has evolved so much over the last decade. Today, we have several tools available: lifestyle modification, prescription medications, endoscopic procedures like the gastric balloon, and bariatric surgery, of course. Every one of these treatments has a role. The important question is not which treatment is the newest, or even which treatment helps patients lose weight. The real question is which treatment gives this particular patient the greatest chance of improving their health and maintaining those results over the long term.
And I think that's the perfect transition into today's topic because one of the questions I answer almost every single day is, Mariana, should I get the gastric balloon or should I get the gastric sleeve surgery? And honestly, I don't think there's another question we hear more often than this one.
I completely agree. It's probably the most common question I hear during consultations. But before anyone can answer that question, they first need to understand how each treatment actually works. Because although both are designed to help patients lose weight, they are very different procedures. They work in different ways and they are intended for different types of patients too.
So, doctor, let's just start with the treatment that has probably become the most recognized bariatric procedure worldwide, the gastric sleeve surgery. I think almost everyone has heard of the term, but surprisingly, very few people actually understand what actually happens during this surgery. So, how can you answer the question of what is exactly the gastric sleeve?
Mhm. I usually try to keep the explanation as simple as possible. A gastric sleeve is a minimally invasive laparoscopic procedure in which we
Mhm.
remove approximately from 70 to 80% of the stomach, leaving a behind narrow tube shape that resembles a sleeve. That's actually where the name comes from. But
Mhm.
here's something very important. One of the biggest misconceptions is that sleeve surgery works simply because the stomach becomes smaller. And while that's certainly part of it, it's not the whole story.
That's interesting because I think that's exactly what most people believe. They think, well, they just make my stomach smaller so I can eat as much. But you're saying that only part of that explanation.
Exactly. If sleep surgery only worked by making the stomach smaller, we probably wouldn't see the remarkable improvements in diabetes, high blood pressure, fatty liver disease, and other metabolic conditions that occur after surgery. There is much more happening physiologically. One of the most important changes involves a hormone called ghrelin. Many people know it as the hunger hormone. Most of that hormone is produced in that portion of the stomach that we remove during surgery. As a result, many patients notice something very interesting after their procedure. They are not constantly thinking about food anymore.
I actually hear patients describe that all the time. Some of them tell me, for the first time in years, I finally feel full. Or I'm not thinking about my next meal all day long anymore. And honestly, it's something that's difficult to understand unless you experience it.
Exactly. And that's why today we don't consider sleeve gastrectomy simply as a restrictive procedure. It's a
Mhm.
metabolic operation. Yes, patients eat smaller portions, but surgery also changes the hormonal signals between the stomach, the intestines, and the brain. That's one. That's one of the reasons patients are able to lose weight and, more importantly, maintain that weight loss much more successfully than diet with diet alone.
So, doctor, if someone asks you, does surgery force me to eat less? What will you say?
I would tell them no. Surgery doesn't force you; it helps you. That's very important. That's a very important difference. Patients still have choices after surgery. They still need to eat well, stay active, follow nutritional recommendations, attend follow-up appointments. The operation isn't magic. It's a tool. Yes, it's a tool, but it's an incredible powerful tool because it works with with your biology instead of
Mhm.
against it.
I really like that phrase. It works with your biology instead of you're against it, because I think that's something patients never really heard before.
And honestly, that's one of my favorite ways to explain it. Most people living with obesity have spent years trying to fight their own biology. They are constantly hungry, their metabolism adapts after diet, and their body fights to regain or lose weight. Surgery helps change that equation. Instead of fighting your body every single day, we are helping restore some of the biological mechanisms that make long-term weight management possible.
Mm. One question I hear quite often is, doctor, if you remove most of my stomach, am I going to be hungry for the rest of my life?
Actually, the opposite is usually true. During the first several months after surgery, many patients experience a significant decrease in hunger. Over time, appetite gradually returns, which is completely normal. The
Mhm.
goal is not to eliminate hunger forever. Hunger is a normal biological signal. The goal is to reduce that constant, overwhelming hunger that makes long term weight loss so difficult before surgery.
That makes a lot of sense because being hungry isn't basically the problem. Feeling hungry all day long, even shortly after eating, that's what makes obesity so difficult to manage.
Exactly, and I think that is an important distinction. Our goal is not to stop patients from enjoying food. Our goal is to help them regain control over their relationship with food.
I think we answered one of the biggest misconceptions about sleep surgery. So now, let's talk about the gastric balloon. I think it's probably one of the most misunderstood weight loss treatments. Some people think it's an alternative to surgery, others believe it's just a quick fix. And honestly, I think most patients really understand what it is. So, doctor, can you explain us what is exactly the gastric balloon?
Okay, the gastric balloon is an endoscopic weight loss procedure, which means there's no surgery involved. The patient is placed under anesthesia, and we insert a deflated silicone balloon into the stomach using an endoscope. Once it is in the correct position in your stomach, we fill it with saline solution until it reaches the appropriate size. It is different in each patient. Some patients 400
Mhm.
milliliters, other 700 milliliters. And the entire procedure usually takes around 20 or 30 minutes, and patients typically go home the same day. And one important thing to understand is that nothing is removed from the stomach, like in the gastric sleeve. The anatomy remains completely intact.
So, the balloon simply occupies a space inside the stomach.
Exactly. Think of it as placing a partially inflated balloon inside an empty backpack. There's
Mhm.
less reliable because the balloon occupies part of the stomach. Patients usually feel full after eating much smaller portions. That fullness helps reduce calorie intake and promotes weight loss. It's a relative simple concept, but it can be very effective for carefully selected patients.
One thing patients ask me all the time is if it's not surgery, why do I have to be asleep?
Okay, that's a great question. Even though it's not a surgery, we still use an endoscope to pass through the mouth and into the stomach. General anesthesia or sedation allows us to perform the procedure safely and comfortably. It also gives us the opportunity to carefully examine the esophagus, stomach before placing the balloon. If we find something unexpected, such a large hiatal hernia, severe inflammation, and ulcers, or another condition that makes balloon placement unsafe, we simply don't place it. That initial evaluation is one of the reasons endoscopic balloon placement remains an advantage.
I've also heard patients ask, can the balloon stay there forever?
No, and that's probably one of the most important things patients need to understand. The gastric balloon is temporary. Depending on the type of balloon being used, it typically remains in the stomach for about 6 or 12 months, although some newer systems may stay different.
Mhm.
Eventually, it must be removed endoscopically. It's not designed to be a permanent implant.
And I think that's where some people get confused because they assume that once the balloon comes out, the weight loss is permanent. But is that necessarily true?
Not necessarily. The balloon is best understood as a tool, or as I often tell patients, it's a window of opportunity. During those months, patients have a chance to build healthier eating habits, increase physical activity, and develop routines that they can continue after the balloon is removed. If those lifestyle changes become permanent, patients can absolutely maintain meaningful weight loss. However, if nothing changes except the presence of the balloon, once it's removed, the stomach no longer has that extra volume occupying space. Patients
Mhm.
gradually um, begin eating larger portions again as before the balloon. Appetite returns to what it was before. And without lasting lifestyle changes, weight regain becomes much more likely.
I really like that phrase of window opportunity because it emphasizes what the balloon is doing isn't doing all the work. The patient has an active role in the process.
Exactly. No weight loss treatment, whether it's a medication, a balloon, or a surgery, can completely replace healthy habits. The balloon creates an opportunity to make those habits easier to establish, but it is still a partnership between the treatment and the patients.
Another question we've been hearing more frequently over the last few years is about the swallow balloon. Patient often asks, why can I just swallow a capsule instead of having an endoscopy? Can you explain the difference?
Of, of course, the swallowable balloon was developed to avoid the initial endoscopy. Patients swallow a capsule attached to a thin catheter. Once X-rays confirms that the balloon is in the stomach, it's filled and the catheter is removed. On paper, it sounds very convenient. However, there are some important limitations. Without an initial endoscopy, we don't have the opportunity to directly examine the stomach before placement. That means certain conditions may go undetected until after the balloon has already been inserted. And although placement may avoid an endoscopy, complications, if they occur, can still require an urgent endoscopy or even surgery.
So, in your practice, is that something that you routinely recommend?
Personally, no. Every physician has their own experience and preference, but in my practice, we generally prefer endoscopic balloon placement because it allows us to evaluate the stomach first and place the
Mhm.
balloon under direct visualization. We believe that provides an additional layer of safety for patients.
Okay, so now what we talk about both treatment individually, we understand how sleep surgery works, we understand how the gastric balloon works, but I think this is where patients really want an answer because the question we hear every single day, which one should I choose?
Exactly. And the answer is not as simple as saying one is good and the other is bad. Each treatment has advantages, each has limitations. The key is understanding which patient is sitting in front of you.
So, doctor, we spent the last few minutes explaining how the gastric sleeve surgery works in the balloon. Um, but can we talk about the who is the ideal candidate for the gastric sleeve for the gastric balloon? Sorry.
Okay. Uh, who is the right candidate for gastric sleeve?
No, for the balloon.
Oh, sorry, for the balloon.
Hmm.
Mm, mm, well, this is a good question. Generally speaking, the gastric balloon works best for patients who need a low or moderate amount of weight loss, someone with
Hmm.
obesity who wants help controlling portions, someone preparing for another operation, or perhaps a patient who simply is not ready for bariatric surgery yet. It's also a reasonable option for patients who prefer a temporary treatment, understanding that the balloon will eventually be removed. The key is setting realistic expectations from the beginning.
And what about the gastric sleeve surgery? Who will be the best candidate to it?
Okay, yes, gastric sleeve or a sleeve gastrectomy is usually recommended for patients with a higher BMI, mm, or for those already experiencing obesity-related medical conditions such as type 2 diabetes, high blood pressure, sleep apnea, fatty liver disease, or severe joint pain. These patients are not simply trying to lose weight, they are trying to improve or even reverse serious health problems. In those situations, we need a treatment that offers durable long-term results.
One thing I heard all the time is, I don't need surgery because I just need to lose 40 pounds. Is the amount of weight someone wants to lose enough to determine which treatment they should choose? I think we're having a problem. He got disconnected. He will come back. Um, I was asking the doctor if the weight should be something that determine what treatment they should choose, but basically not necessary. The number on the scale is only like one piece of the puzzle. Um, Now, we also need to look on the BMI, the medical history, previous weight loss attempts, eating behaviors, metabolic disease, their age, the quality of life, and perhaps most important, what is the patient hoping to achieve 5 or 10 years from now. Those factors are often much more important than simply just saying, I just want to lose 30 pounds. So now we're gonna talk about expected results because that's another question patients ask all the time. How much weight can I actually lose? Talking about statistics, with gastric balloon, patients generally lose around 10 to 15% of their total weight, especially when they actively working with a nutrition and lifestyle program. But with the gastric sleeve, the average weight loss is considered greater. Most patients approximately lose 30 to 40% of their total body weight. That's between 60 to 85% of their excess of body weight, depending on long term follow up and adherence, of course, to the healthy habits. So both treatments basically are effective. The difference is the magnitude and the durability of the results. I think another topic we can't ignore is medication, because over the last few years, everything has changed with weight loss. Now patients come in asking about semaglutide or tirzepatide, most commonly known as Ozempic or Mounjaro as the brands, before they even ask about surgery. Um, Basically, all the GLP-1 medications have transformed obesity treatment. Clinical trials have shown that semaglutide can produce average weight loss of approximately 50% of total of body weight. More recently, the tirzepatide, the Mounjaro, has demonstrated average weight loss between 20 to 22% in many patients. That's even more than the balloon can offer. So those are remarkable results. In fact, they're approaching, or in some cases, exceeding the average of the gastric balloon, as I mentioned. Um, so will it be fair to say that the medications have changed the role of the gastric balloon? And I think that's exactly what it's happening. The balloon hasn't become a bad treatment. It simply occupies a different place than it did 10 years ago. Now with the medications, we have other options before the balloon. So today we have highly effective medications for patients seeking a non-surgical approach. As a result, we use the gastric balloon more selectively than we did in the past. Uh, it still remains an excellent option for the right patient, but today's treatment decision also includes medications that simply weren't available 7 years ago. So sometimes people think a treatment disappears because it doesn't work anymore, when reality medicine evolves. New tool becomes available and physicians adapt accordingly to those changes. So our goal isn't only to defend one treatment over another. Our goal is to offer patients every evidence-based option available and help them choose wisely. Sometimes can be medications, sometimes can be the balloon, sometimes can be surgery. So then, why do many patients who qualify for bariatric surgery ultimate choose the gastric sleeve? And basically, because when we look at long-term scientific evidence, the gastric sleeve consistently provides a greater and durable weight loss than temporary treatments. The percentage of regaining weight after a weight loss surgery is less compared to other treatments that we have in the that we have to offer. I think Dr. Guerrero wants to connect. He's still having some problems, but I'll continue with the topic. So, would it be fair to say that when someone truly meets the criteria for bariatric surgery, the conversation isn't simply about losing weight anymore? Hello, doctor, you're back.
Hello, sorry, I had a problem with my computer. It did. I don't know what happened. It didn't want to turn on again. So I'm from my cellular. Sorry for what happened.
No worries. I'm gonna make you a question, okay? So why do so many patients who qualify for bariatric surgery ultimately choose the sleeve gastrectomy?
Okay, we must evaluate each patient as we said before. Uh, uh, Depending gastric balloon versus gastric sleeve, they are not for all patients. If someone want to lose more weight, patients lose more weight with the sleeve than with the balloon. Balloon patients can maintain the weight loss uh, because bariatric surgery is the most effective weight loss procedure more than the gastric balloon. So if patients have a higher BMI but and want to lose more weight, they are better option. Their gastric sleeve is a better option than the gastric balloon.
Yes, absolutely. And also, besides the weight loss, it also offers significant improvement in obesity related diseases. It helps to improve even to the remission of type 2 diabetes, to improve the blood pressure disease, the sleep apnea, fatty liver, the joint pain. In other words, basically, surgery isn't just changing the number on the scale, it's changing a patient overall health trajectory. So, will it be fair to say that when someone truly meets the criteria to for bariatric surgery, the conversation isn't simply about losing weight anymore? It's about treating a chronic disease.
Yes, I agree. Is as gastric sleeve offers you a more permanent weight loss, you can control or avoid metabolic diseases, as the one that you already said, diabetes, hypertension, sleep apnea, infertility, and many others. So it would be a better option that the sleeve.
And also, of course, the weight loss is important, but at the end, it's not like the final goal. The real goal is living longer, living healthier, improving quality of life. reducing complications, and helping patients regain the ability to do things that obesity may have taken away from them. When we focus on those goals, choosing the appropriate treatment becomes much, much clearer.
Yes, I agree. And it is also very important to follow all the recommendations as such as diet, physical activity, vitamins, supplements, uh, to maintain that weight loss for the rest of their life.
Hmm. So now we talk about the benefits. Now let's talk about the other part that also patients ask a lot. That are the basically what are the risks or what are the chances of having patients. They can think about what if something goes wrong. I'm scared of having a complication. So what is your perspective from that? What can you tell us?
It is a good question, and I think that it is very important to explain to all patients that it is normal to be scared. It is not like everyone is in the operating room every day, so it is normal to be scared. But I think that while the patient knows more about the process, about the surgery, the process before and even after surgery, patients can feel more confident and less scared. So that's why it is very important to be in communication with your bariatric surgeon and or the team, for example, with Dr. Mariana, medical coordinator. And I always explain to all patients that the procedure, mm, even intragastric balloon or gastric sleeve or any other surgery, not only bariatric surgery, as minimal as they are, they have their own risk. Even uh, have allergy to any medication, for example, but that's
Mhm.
why you are with board certified physicians or specialists, because each body is different, and depending of the reaction of the body, we must treat each patient because we treat people, we treat humans. We don't treat like what we read what we only read in the books, right? And
Mhm.
the risk, the most common risk in the gastric sleeve, in they could be, we can divide in both, and short-term risk and long-term risk. Short-term brings risk, or risk that can happen during surgery. They could be bleeding, for example, or infections, or pain, or nausea, or vomiting after surgery. And but we always take all the precautions to decrease that risk. We give to our patients IV medications even before surgery for avoiding nausea, pain, gastritis, vomiting, and during the surgery, the surgical technique that we do, or that I perform, is like always doing a double check to decrease the risk of bleeding or leaks. For example, we always do two leak tests. One during the surgery in the sleeve, once we finish the gastric sleeve, and the second leak test 1 day after surgery or 24 hours after surgery. So what I want to say is that all the procedures have risk, but while you are with the um, uh, with board certified specialist, that risk decrease as much as possible. And a long-term risk, they could be malnutrition when patients don't take the enough vitamins or supplements, or they don't have the recommended follow-up appointments. Uh, in our team, we ask or recommend blood work test 3, 6, or 1 year after surgery, depending of each patient. And according to the results, we can increase or modify the vitamins and supplements. And patients with gastric sleeve, some of them can develop acid reflux symptoms, for example, A majority of these patients can be treated with medications, but if it is not, if they are not enough the medications, well, we it would be good to evaluate another surgery, revision surgery, sleeve to bypass, but not all patients. Not all patients, of course, will develop severe acid reflux symptoms. It's a very low portion. I think they are the most common risk, short term and long term risk.
Yeah, and talking about the short term, it's really minimum. The risk is like between 1 to 2%, right? And doing a good preparation with a good team around, so we can give medical indications. The pre-op diet also has an important role, so they can prepare the abdomen, also reduce the risk of having complications. A good screening while they're here and also before coming. That's why knowing all the medical history of the patient is important, so we can um, detect uh, things that are potential risk for the patient, so we can request, I don't know, a specific clearance for a specific speciologist, um, so we can reduce any event that can happen while they're here uh, at the facility having surgery. So yeah, it's something that it's not that common. It most can be avoid. Uh, that's why having a good team around and a good preparation, I think those two things are very very important to reduce the risk of having complications.
Yeah,
So
and you mentioned, sorry, you mentioned a very important point, the preparation for surgery. That's why we always want to have surgery, sorry, to have the consultation before surgery and give all the recommendations to our patients. Uh, Pre-op diet, as you said, taking omeprazole 1 month before surgery, stop drinking coffee 4 weeks before surgery. Do not take
mhm,
NSAIDs medication 7 days before surgery because they increase the risk of bleeding. And for patients who are taking GLP-1 medication, stop taking them 3 weeks before surgery, and many other recommendations to prepare the patients for surgery and decrease the risk of complications, as you said.
mhm. And well, that's basically talking about the gastric sleeve. But patients think that if I'm having the balloon, that means because it's not surgery, I'm not gonna have risk of having any complications. But they also exist complications in the gastric balloon. Can you tell us about that?
Yeah, as we said before, all procedures have their own risk of complications. In the gastric intragastric balloon, for example, there are some patients that don't tolerate it. They can develop a lot of symptoms such as nausea and vomiting.
Mm-hmm.
And one option is go again to the operating room and decrease the size of the balloon. But even doing that, patients uh, cannot tolerate it. And symptoms such as nausea and vomiting, um, patients commonly lose less weight with the balloon that with the gastric sleeve. Another risk is that the balloon mm, doesn't work well, and I mean that the liquid it leaks, and the balloon gets empty. The risk is very low, but it exists, and I think they are the most common, and also risk to anesthesia, because during the procedure of intragastric balloon placement we use sedation, and okay, they can have some risk for that, and I think they are the most common risks.
So if someone approached to you and wants you to help them decide what is the best for them, what will be the approach?
Okay, first I must evaluate each patient. I
Mm-hmm.
must know their own metabolic diseases, their goals, and the objective of having that weight loss process. Uh, First option, and also the weight, the BMI. First option, gastric sleeve. Mm, if they want to lose more weight, if they have metabolic diseases, and even evaluate another more complex bariatric surgeries, maybe a BMI higher than 35, gastric sleeve, and uh, if patients follow very good that recommendations,
Mm-hmm.
with both they can have the weight loss uh, for the rest of their life. But there are patients who don't want any invasive procedure, and they
Mm-hmm.
see the gastric sleeve as a more complex or invasive procedure. So
Mm-hmm.
maybe it could be a gastric balloon. And patients who don't want to lose a lot of weight, patients who maybe the BMI is lower than 35, and they are not looking for a large amount of weight. So it could be the intragastric balloon, or patients who say that they don't have enough time for recovery, even that the recovery time is very fast with the sleeve, but
Mm-hmm.
it's faster with the intragastric balloon, depending of the time that they have for recovering.
Okay, but also in your practice, what's been like your experience in the patients who decided to go ahead and do the balloon instead of surgery with the maintaining? Because we had several patients that, not from like our original patients from the balloon, but that they had the balloon on, I don't know, a few years ago. They remove it, they're regaining the weight back, and now they're looking for something more, like a more powerful tool. So what's been your experience with patients that they decided to go with you and had the balloon? What are the
Okay.
results in the long term?
Okay. With even balloon or sleeve, they must follow
Mhm.
all the recommendations. As
Mhm.
we said before, healthy habits, eating healthier, physical activity, vitamins, supplements, follow-up appointments. But mm, mm, uh, there are higher risks of regaining the weight with the balloon than with the sleeve,
Mhm.
much higher risk. There are some researches that shown that even 90 or 95% of patients who had an intragastric balloon, they regain the weight that they lost 1 or 2 years after the gastric balloon. So that's
Okay.
when they come back for another weight loss option, sleep, for example. What I want to say is that there are more risk of regaining the weight with the balloon, much um, more risks than with the sleeve. So many of them regain the weight and then look for another weight loss option.
And I think that many patients overestimate the risk of bariatric surgery, and they un- they underestimate the risk. They overestimate the risk of bariatric surgery, and they underestimate the risk of living with obesity, because the risk of serious complications after sleeve gastrectomy is very low. Um, but the long-term risk associated with untreated obesity are significantly greater and continue to increase over time. We were talking about that having a sleeve gastrectomy has a risk of complication from 1 to 2%. And a patient that lives with obesity that is not receiving treatment has the risk of complications more than 40%. So if you put that like in a balance, um, that is something that patients should have like in mind when they make the decision to go ahead and go into surgery. Like, don't focus on that 1 to 2%. Focus on all the things that you're gonna change by doing surgery. What all the things that you're gonna improve in your health, and that you're gonna stop those diseases to going on, and the risk of having complications in the future because of those diseases you have that accompany your obesity. So
I
that's
agree with you.
something that it's
Eh,
very important for to explain to the patients.
Yeah, I agree with you. Finally, sleeve, and not only sleeve, all the others bariatric procedures um, have been evaluated for years. Gastric bypass, gastric sleeve, and others. More than 50 years of researches that shown all the benefits that they have and the risk, as you said before, and
Mhm.
how to avoid this risk. So all of these procedures are um, well, the steps, we all know, the specialist, we all know the steps that we must follow, the protocol in surgical technique, in pre-surgery evaluation or preparation, and that the risks are very, very low. And in the other side, uh, well, obesity is in relation with many or almost all the metabolic diseases: hypertension, high blood pressure, sleep apnea, high triglycerides, high cholesterol, heart attacks, sleep apnea, and infertility, and many others diseases.
Okay, so to close um, the topic of today, um, what advice can you give to a patient that comes to your consultation and wants to have surgery?
Uh, what advice I give to my patients? What more, sorry? I did not hear well.
That imagine there's a patient that comes for the first time to your consultation and wants to
Okay.
have a weight loss treatment
Okay.
or surgery in this case. What would be the advice for them?
Okay. Well, I have patients every day looking for information, and many of them go to the consultation for information, and then take the best decision, of course, with the specialist and according to their goals. So, first, I must know the medical history of my patient, and then their goals. After knowing that, I explain to my patient all the options that we have for weight loss, uh, GLP-1 medications, then intragastric balloon, and then bariatric surgery, mm, and the endoscopic sleeve too. So, according to the goals of my patients, I explain each option, and explain the benefits and the risk of each one. And according to their goals, we take the best decision or option. And of course, it's not like there is the best option for weight loss. It is always depending of the patient. Uh, is the best option according for each patient. Maybe is one option is the best for one patient, but not for the other one.
Yes, absolutely. I think I very agree with you with that. My advice for the patients would be don't compare to yourself. Not because your friend did the gastric sleeve or your neighbor, that means you need to have the gastric sleeve. Make your questions during consultation, do your research, um, choose a good team that is going to be with you, a certified team, of course. And to follow all the recommendations, that's also very important for your success, and to change all the bad habits that leads to obesity, because at the end obesity is something that is chronic. It's gonna work all the tools that you're gonna use while you use them well, and I think that will be my advice for them.
Yes, I agree with you.
So I think I don't have more questions. Is there something else you want to talk about?
No, I think we have talked about the most important points. And Edward Sanchez uh, and Tara Wally are asking how much cost. How much? It is different the procedure and depending of the patient. But you can contact us, and then we can evaluate your situation and then give you the special price that we have in this moment.
Yes, absolutely. I think that's one of the most common questions I also receive every day. Like, what's the price? What's the price? What's the price? But at the end, we're not selling furniture. We need to evaluate what's the best for the patient, and of course the price will depend at the end of the type of procedure, the needs of each patient. So that's why filling your medical questionnaire will help us a lot to know and help you decide what's the best for you. And also having consultation with Dr. Guerrero will help you to clear up all your questions you have during the process, and he will absolutely help you choose what's best for you, because we're not looking to treat the obesity in the moment. We're trying to look what is best for the long term. So you can contact us on any of our social media and our WhatsApp, and we can help you through every step.
Yes, thank you. And Edward is asking, do you warranty your service? Mm, mm, what do you mean with warranty? Mm,
Yeah, I
okay.
don't understand that question either. What does he mean with do you warranty your service?
Yeah, we all are, all our team, we all are board certified specialists. Uh, we can show that. And we also have a private Facebook support group where you can know many of our patients. It is a community. You can know their progress, the benefits, the before and after pictures, and you can even ask about their experiences, and they will also guide you, and we will be with you throughout your weight loss process.
Yes, you can contact us, Edward, and I'll be happy to send you the link so you can join on our Facebook group. And right there, you're gonna see other testimonies, before and after pictures, and even you can make your questions, and real patients can answer for you also. So thank you, Dr. Guerrero,
Thank
for
you very
joining us
much.
today to talk about this topic, the gastric sleeve versus the intragastric balloon. I think you help us to clear uh, our mind, and contact us
Thank
for
you.
more information, and I'll be happy to guide you.
Thank you, Dr. Mariana, too, for your time. And thank you, everyone who has joined with us in this live. And we are inviting you to join to our private Facebook support group, too, where
Mhm.
you can know many many important information or tips about weight loss process. And you
Mhm.
can know many of our patients, their before and after pictures, their progress, and you can contact us if you have any other questions.
Mhm. Oh, one last question. So for the gastric bypass, how long for recovery? Basically, it's the same for a gastric sleeve or gastric bypass. Recovery is basically the same because both are made laparoscopically.
Yeah, both sleeve and bypass is the same recovery time.
Hmm.
Patients are walking since that day of surgery, and one of the recommendations is walk every 3 hours for 10 minutes. And patients, the recommendation of resting is from 1 to 2 weeks. It is different depending of the job of each patient, but the recommendation is don't do not weigh uh, do not lift weight more than 15 pounds for 3 weeks and 35 pounds for another 3 weeks. So patients who work from home office, 3 or 5 days after surgery, they are working in the desk. But if you don't work in home office, 10 or 14 days are enough while you follow the recommendations of weightlifting.
Okay. Well, thank you, Dr. Guerrero, and hope to see you in the next live.
Thank you very much, Dr. Mariana, and thank you everyone for joining us.
Bye bye.
Bye.